Hello everybody, thanks for clicking. This is a short presentation on how to keep your gums healthy and your breath fresh during a pandemic when you can't go out. So one of the things that might affect people as they're stuck at home, unable to visit the dentist, is gum disease. Gum disease is basically when the gums get red and swollen and tender. And the primary cause of this is the accumulation of plaque bacteria along and under the gum line. And they start attacking the body like an army, attacking with white blood cells of your body attacking back. It's this war going on between them that causes gum disease. So why do bad gums cause bad breath? Well, one of the reasons for that is the bacteria that are attacking your gums also produce bad odors. In addition to that, the cells, your own white blood cells, when they die, they break down, also releasing compounds that cause bad breath. Other reasons can include bacteria and food debris on the tongue, infected tonsils, and stomach problems. So many people wonder what dental plaque is, and in simple terms, it's the white stuff that you can scrape off with your fingernail. Looked at under a microscope, it's a mass of bacteria and polysaccharides, basically sticky substances that help them stick together to form this mass. Once they've done that, they start to call in the nasty, more aggressive bacteria that start attacking your body. Not to be confused with tartar, which is basically just calcified material that builds up around the teeth. But tartar is not the main reason for the gum disease. It's the bacteria on the tartar that are attacking the body. In theory, if you have clean tartar, you might not have gum disease. Gum disease is primarily two things, either gingivitis or periodontitis. In gingivitis, we get red, swollen gums. They bleed, they're tender, you can have a bad smell, but it doesn't affect the deeper tissues, like the picture on the very far right here. So on the left, you've got healthy gums, which are pink and firm, they're not swollen, they don't look like they bleed. And on the right-hand side, you see swollen gums with quite a red margin around them. That's gingivitis. Periodontitis is when this bacterial attack starts to affect the tissues deeper inside, where the fibers that attach the gum to the tooth begin to dissolve away, the fibers that attach the tooth to the bone are affected, which is called the periodontal ligament, and the bone itself can be affected. This is where you get pockets and can eventually cause the teeth to loosen and to fall down. So a lot of people worry that they might lose their teeth through gum disease. It is possible to lose your teeth through gum disease, however, with simple cleaning measures at home and at the dentist, a lot of teeth can be saved. Because gum disease is caused by plaque and the body's defensive action against the plaque, then the simplest solution to get rid of gum disease or to reduce it is to get rid of the plaque. At the practice, we're often faced with patients who've experienced gum disease but haven't brushed their teeth because their gums were bleeding. They were afraid that by brushing their teeth and causing them to bleed, it was causing more harm. However, the reverse is true. In reality, by continuing to remove the plaque, eventually the bleeding will stop. So here are a few ways to keep the teeth clean. Your toothbrush needs to be addressing the gum margin, it needs to be running along the gum line, even if it's bleeding. The best solution to making your gums stop bleeding is to keep them clean. You can use an electric toothbrush, again along the gum line, and it's very important to use the interdental brushes in between the teeth. Often we brush our teeth really well on the surfaces, on the inside and the outside, but not enough in between the teeth. Here, there are some flossing pictures which show you how to wrap your floss around the tooth. It's useful to understand that toothpaste, although useful, is not the primary way to clean teeth. It's actually the bristles of the toothbrush that disrupt that plaque that really make sure that the plaque can't attack the body. However, toothpaste does contain abrasive particles that help scour the teeth, detergent-like products to help break down the plaque, and obviously contains fluoride, and that fluoride actually makes the plaque less sticky. So if it were that easy to treat gum disease, why do we need dentists? Why do we need hygienists? Well, what we do is we remove the tartar that harbours the bacteria. We also teach you how to keep your teeth cleaner, and we can clean deeper into those deep pockets where toothbrushes won't go. Sometimes we do advanced treatments like changing the shape of the gum and changing the shape of the bone to make it easier to clean and to make the pockets that are created by the gum disease shorter so the toothbrush can clean more thoroughly around the teeth. Mouthwash is useful in the fight against bacteria. However, unless you disrupt the dental plaque, the mouthwash is like taking a shower with your clothes on. It's very important to understand this. So what mouthwash does, especially these chlorhexidine-containing mouthwashes, is to reduce the number of bacteria. But if they're in that thick, sticky layer of plaque, the mouthwash is useless. So again, it's very important to brush the areas really well and to use the mouthwash to reduce the buildup of plaque. I'm not saying it's not useful, however, it's got to be used after brushing. A couple of times a day for a few seconds each time for a maximum of a week should do the trick. My main message is that if you're stuck at home and can't see the dentist and you've got bleeding gums, brush them more. Even if they bleed a little bit, carry on brushing and things will improve. Thank you very, very much for watching this. I hope it's been useful to you. If you need any advice, please go to our website, regencyhousedental.com, and find us on Facebook. Thank you.